Just as a baseline, GRESB is a tool for reporting to investors. It's a tool for engaging with investors. Of course, as a separate benefit or as a separate use case, GRESB is used as an engagement tool for managers themselves and from the listed companies themselves to organize their internal processes and management practices and their strategies and help them prioritize what they're doing. But first and foremost, it was designed to be a tool for engagement to investors and for investors to be able to scrutinize and compare their ESG vehicles, their real estate vehicles from an ESG perspective. And over time, that type of relationship, that stick, that's the investor community combined or brought together with the fund managers, with the listed companies that obviously recognize the merits and the direction of the industry and recognize the fact that, yes, changes have to be implemented and things have to be done, has led to this steady improvements out there. What you see here are the average scores. So every year we put out this assessment based on which we evaluate the ESG performance of real estate vehicles. This assessment yields an overall score, which is based on two dimensions. How do you strategize on ESG? What are your programs and policies and procedures? How do you structure ESG within your business and within your organization? And how does that reflect into your real estate portfolio? So this is basically what the two dimensions are. And what we've seen is that this doesn't even include 2009 and 2010 when we were running an assessment, but it's just back then it was a very academic exercise that's difficult to compare to what it is now. We've seen that there's a steady improvement on both directions. Just right off the bat, 2019 is going to be, if not exactly the same in terms of the questions we put out there, maybe just small tweaks, corrections from last year. Our focus is going to be on improving the asset level tools and the reporting tools, so cleaning the bugs and the problems that we identified last year. So apart from that, everybody can count on 2019 as being a consistent year to 2018. But that does lead to a question, and that does beg a question. We're very close to that 100 mark, and if you look at that top corner, it's difficult to differentiate between the dots. They overlap. So if you ask the question, like Richard was saying, it's time to raise the bar. We've done all of that baseline things. What next? I was really impressed with the case studies that M&G presented today. These are amazing use cases and examples from out there of what can be done within the portfolios that's maybe not even in the traditional spectrum of ESG, and that's not really incorporated in this. So from what we see and from our focus for the coming years is to try to incorporate some of these elements into the baseline, so raising the baseline for everyone. For the upcoming period, we've identified three focus areas that, when I say upcoming period, and I don't mean 2019, I mean 2023, 2025, 2045, 50. It's not an industry that changes overnight. And we've seen a lot of initiatives from the World Green Building Council, from the TCFDs, from the SDGs, from other initiatives out there that have tried to set long-term direction targets. And these are the examples and initiatives that we're trying to align with as well. So we're going to try to encourage and lead to healthier, more resilient, and more efficient assets, because we think that these are three of the core characteristics of what a sustainable asset, a sustainable building is. And for today, I'm only going to focus on the healthy bit because we've been doing work on this over the last 3 years. Not as part of the real estate assessment, the core assessment that the entire industry, I won't say must or has to report on, but that is encouraged to report on by their investors, and based on which they receive their overall score. But we've done this as a separate exercise, a modular exercise that was driven and inspired by the leaders out there. So 3 years ago, we looked at what is the industry as a whole. If you look at the leaders of in Australia, in North America, in Europe, some of the really good examples from Asia as well, what do they consider to be next step? Sure, energy, carbon, water, waste, efficiency measures, all those things, they're still on the agenda for everyone. But when you think of macro trends and focus points, what are they busy with? And health and well-being came at the top of a lot of agendas. So that's why we created a separate module through which we managed over the last 3 years to identify the key priorities and the standardized metrics that can be used to measure health and well-being. Do investors care about health and well-being? It's interesting that with this topic, investors care about good management practices. And good management practices do account or do incorporate a focus on sustainability in general. Now, I can tell you that the standard, typical investor won't really come and ask super detailed questions about health and well-being. They'll ask about your general strategy and they'll ask about the main trends. Health and well-being, as opposed to the traditional ESG topics, was driven a lot by the clients and by the tenants, by the assets. So unlike ESG as the typical environmental social governance, which was driven a lot by the investor community because of costs and risk, health and well-being started as a value differentiator. So I think investors learned about it later than the tenants, the clients learned about it and demanded it. So it's a different dynamic out there. With that being said, yes, investors care about health and well-being, and they're starting to learn how to ask the questions. And that's what we see after 3 years of engaging the market on what's the most important elements of health and well-being from the perspective of employees means and health and well-being in the real estate assets means. This year, because we were talking about leaders, we had 11 companies that scored a perfect score, 100, full 100, but 155 out of 297 companies scored more than 50, again, on both dimensions. 17 of those coming from UK. So obviously there are good examples and good leaders to follow very close to home in the UK and then in Europe. So the premise of our assessment and our analysis was looking internally at the organization, at the entity, and identifying whether or not the manager itself knows how to address or how to start evaluating health and well-being needs in order to identify the corresponding measures. And what we've seen is that companies do indeed tend to start internally, and then as they become more educated and more accustomed to what health and well-being means, that culture will be reflected in the real estate assets as well. It's a circle. I think Ollie called it start with map, materiality, managing, and monitoring. Right? I think that's a parallel from the Plan to Check Act cycle of ISO, which is a very important applicability. I would like to set the foundation of what we've learned. What are the results of this 3-year analysis? Because this is what informs the future developments. What we see now is that most companies, and again, this is a self-selected group of companies that chose to report on the voluntary module, so the 297. On average, 88% of them identify or have started identifying the needs of their employees. A very good example came from Joe. You said that our tenants in the residential part are typically early 20s to early 30s, right? So you know very well who you're targeting. You know very well who your clients are and what they need and how they work. You could have done apps and electric vehicles and all that, but I don't know if my mom would use it, to be honest. If the standard or if the occupants of the building would be a more diverse group. And this is exactly what we mean, and what we're trying to figure out is do you understand who you're addressing? Do you understand the needs of the group, of the population that you're addressing? There's, along with that, over the past 3 years, I think we've seen a lot of activity in the space with the emergence of building certifications and so on. And in general, we see that there are the sustainability managers, the directors, or other members of the teams do get qualifications that cover health and well-being. So they learn how to talk about health and well-being and how to incorporate it. They won't be necessarily public health experts, but there are generally qualifications that allow them to engage the necessary teams to be able to drive a proper project management effort. We've done this analysis. We've done the analysis of what's relevant, what's baseline, what's standard, both externally and internally. Externally means within the real estate assets. Internally means for your employees. To be able to identify what's the level of detail and information that we can claim as necessary and important for the entire market to adopt. So if we look at the leaders that chose to report the indicators on this module for over the past 3 years, we'll see a wide array of information, a large array of case studies, a wide array of efforts and engagements, a wide array of trial and error exercises, really. It's some of them will work, some of them will not. I was talking last week to a couple of fund managers, and they were saying, well, we have a couple of assets, residential assets with pools at the top floor. This is the signature element of this buildings. We immediately managed to lease out the entire space. But quite frankly, nobody ever uses those pools. Well, what do you think? What are you going to do about it? Nothing. These are. We'll try to organize some events every once in a while. It's a nice. Potential. It's a nice benefit for tenants. They know they can have it. They know they can access it, and they'll use it every once in a while. But in the end, you can't expect everybody to be at home the entire day and go to the pool and spend time at the pool. But that is that value differentiator element that helped them lease out the entire space immediately. And examples like this exist that engage the tenants. At the moment, there's some clarity and some consistency as far as internal measures go. And if we think of, so what will be incorporated into the assessment next year, we do have some indicators that address this. We're going to just maybe add additional elements to those, maybe voluntary elements, or just rephrasing of the existing ones to cover elements of health and well-being more specifically. As far as external measures go, that's still quite difficult to standardize. There are many programmatic strategies that are being implemented, but it's very difficult to standardize them. So in the lack of standardized metrics that can be compared and benchmarked and scored, that's part of the topic that remains still at the case study level and individual company level that can't really be benchmarked, I would say. But over the next few months, we're working with the Robert Wood Johnson Foundation to do some more work, to combine our analysis with public health analysis and try to find some metrics with strong analytical value that can be incorporated. What we've learned so far is that tracking and setting intentional goals does prove meaningful. So an intentional program, not ad hoc programs, does prove meaningful. It does provide, it does predict future performance and future results. Companies increasingly have the knowledge and skill set to improve their performance. Or if they don't have it internally, they know where to go and access it externally. Investors care about health and well-being scores. And this is the scores are the representation of whether or not... They don't care about them in the sense of 75 to 72 or 75 to 70. They care about them in the sense of 75 to 20. And at the moment, it's still, since we're talking about an emerging topic and a voluntary topic, really, as it was until now, they care about, did you do this voluntary thing? Did you fill out this module? Yes, we did it. Figured out a couple of things. We're going to have some other additional meetings. Fine. Maybe it stops there. Generally, if you ask, so did you do this module? I heard GRESB has this module on health and well-being. What do you think about it? Have you gone through it? What do you think about it? Is it does it make sense? Well, we didn't look at it. Why? And maybe it stops there. So I think it's still at the point where it's not engaging on health and well-being at a very detailed extent is not going to imply or not going to attract very severe consequences, financial consequences from the investors. But being able to engage on the topic is getting important. In the same way as being able to engage on resilience and, for example, TCFDs or SDGs is important. These are topics and these are words and phrases that you hear everywhere nowadays. Investors learn how to at least ask about them. So generally when you're in a meeting and maybe you get 5 questions and you answer 3 of them with no, it just sets, I think, the wrong baseline. So health and well-being becomes a value differentiator between companies, and they are becoming an integral part of their general strategy. I'll give the example of a company in Italy. Very impressed with their program. It's Coima Real Estate. It's a listed company. One of their values, like company values, is happiness. And when Joe put that on the slide, well-being, the transition from health and well-being to happiness, I thought, Jesus, who would put that as one of their values in the real estate industry? I've never seen something like that. But when they explain it, it makes a lot of sense. In the end, you're creating spaces, you're building to create a comfortable, safe environment for your tenants, and you want to attract new tenants by creating a value differentiator. In the end, if you ask anyone, an individual, a person, what do you want to be? Maybe they won't start with happy, but we know we all want to be happy. So when this becomes a selling point for the company, well, I would go for that, for sure. In terms of next steps, keep an eye on our newsletter and our website. In collaboration with Robert Johnson Foundation, we're going to write a report that consolidates the efforts for the last 3 years and the conclusions. And these conclusions are informing the specific indicators or what's left, the selection, the clean selection of what will become part of the mandatory real estate assessment. And that's coming in full or parts of it before the end of the year. So not a long time to wait. As far as, I think some of this can also be linked to the resilience bit. When we talk about health and safety and incidents and number of deaths and casualties and all that, that's specifically relevant for the development sector, for new builds. That's a bigger risk in that area, but we do track the injury rate and absentee rate and absenteeism, for example, for the employee body as well. We don't ask what you do with it per se afterwards, or why is that, or what do you do, are you trying to reduce those numbers? But there are elements of, do you measure those, what are they, and it's basically show that to your investors, let them ask the questions. But maybe it's maybe something we can discuss in more detail. How can we make that bit more prevalent in the way we make the link between risk and value? Thank you.